What this book mostly isn't is a wonky book. We also don't spend a huge amount of time telling you all the terrible things that have happened to people as a result of our healthcare system not being universal and not being having cost controls. We really spend time talking to you in fairly plain language about the history of healthcare reform, how we got here, why what the president is proposing is very good, and why the whole thing needs to pass and not some part of it. And we go through it in kind of language that ordinary people can understand. What is the problem with our healthcare system? Why does it cost so much? Why is it so hard to change? Things that people need to know in order to understand why the legislation is so hard to change, and things people need to know to get their senators and congressmen to do the right thing. It really explains in plain language the details of the debate. We try to get away from very complicated terms, and when we do use complicated terms, we explain them so that ordinary people can understand what they mean. And that's important because it's hard to talk to your senators and your congressmen without getting confused. This is an incredibly complicated issue, but it's also a very personal issue, and people need to know why the system isn't working right. The other thing about this is that health insurance the health insurance reform has always been sold as a problem for the 20% of Americans that don't have insurance. The real fact is that it's a problem for the 80% of the Americans who do have insurance, because their jobs are going someplace else because we're not competitive. And one of the big reasons we're not competitive is because our healthcare system just doesn't work for our businesses anymore. And we spend a lot of time explaining why, if you want to have a strong economy in America, you've got to have real healthcare reform. Every industrialized democracy on the face of the earth, except for the United States of America, has a healthcare plan that covers everybody. Every industrialized democracy on the face of the earth does healthcare for all its people cheaper than we do healthcare for 80% of them. And we also know that of all the democracies on the face of the earth, America ranks 17th in terms of how well we take care of our people. Now, that's a pretty failed system, and there's a number of reasons why, and there's a number of things we can do to fix that system. When I started as a medical student in New York City in a public hospital, it was pretty clear that we had a system that doesn't work for an awful lot of people. And because the system doesn't work for about 20% of our people, it really doesn't work for 100% of our people, because all the costs that are borne by the 20% are shifted onto the people who already have insurance, first of all. Secondly, all the incentives in the medical system make people sicker, not better, in terms of increasing all kinds of numbers of unnecessary procedures and so forth and so on. But the real thing that drove me once I became a physician was the justice of it. If you've got to have a system of economic justice in this country, if capitalism is going to work, it has to work for everybody. And the great empires that have fallen over the centuries have fallen because they failed to work for everybody. Over a period of time, the people at the bottom were forgotten, then the people in the middle were forgotten, and pretty soon the vast majority of people were forgotten. I don't want that to happen to America, and having a decent healthcare system has a lot to do with that. When I got to be governor, I realized that I had an incredible opportunity to actually do something about this. We tried to pass a universal healthcare system in the early 90s, which failed because of the federalization of a lot of the system. The individual state is not going to be able to do this by itself. But we did get something pretty close to universal health insurance for everybody under the age of 18. And I realized if we could do that in a small, middle-of-the-income packed state like Vermont, that the country could do it as well. And then I realized that there was no reason to delay health insurance reform any longer. One of the reasons I wrote the book was because the American people need to frame the debate, not senators and congressmen. This is something that affects the American people, and the health insurance industry gives a lot of money to senators and congressmen, so naturally they're going to be influenced. In addition to their need for the votes of their public, they're going to look at those contributions and think, we want to make sure that they side with the people who vote, not the people who write the checks. And there's ways that people can be heard to make a difference, and this last election showed that, and we want to make sure that momentum keeps up and that this bill's not hijacked by people who have a monetary interest in making sure that we don't change the system. There are a lot of things that individuals can do about this. You don't have to be a governor or a physician. All you have to do is be an American to change this. This is a political problem in many ways, not just an economic problem, and political problems can be solved when the people want to do something about it, as the last election showed. So there is a list of things that individuals can do, especially in this internet age, to have a major effect on the politics of this one. We don't have to put up with second choice. We don't have to choose between the lesser of two evils. There's a system that will work, and you can do something about it. When you read this book, you'll find out what it is.